Hi guys, welcome to our channel. Today we are going to look upon part 2 of Polycystic Ovary Syndrome, that is PCOS. So without wasting much time, let's get straight into it. So in diagnosis of PCOS, your doctor is likely to start with a discussion of your symptoms, medications and any other medical conditions. Doctor also may ask about your menstrual periods and any weight changes. A physical exam includes checking for signs of excess hair growth, insulin resistance and acne. Your doctor might then recommend pelvic exam. During a pelvic exam, doctor can check your reproductive organ for masses, growths or other changes. Blood tests. Blood tests can measure hormone levels. This testing can exclude possible causes of menstrual problems or androgen excess that mimic PCOS. You might have other blood testing such as fasting cholesterol and triglyceride levels. A glucose tolerance test can measure your body's response to sugar. Ultrasound. An ultrasound can check the appearance of your ovaries and thickness of the lining of your uterus. A wand-like device that is transducer is placed into your vagina. The transducer emits sound waves that are translated into images on computer screen. If you have a diagnosis of PCOS, your doctor might recommend more tests for complication. These tests can include regular checks of blood pressure, glucose tolerance, cholesterol, and triglyceride levels, screening for depression and anxiety, screening for obstructive sleep apnea. Further moving up to, we will see how pregnancy and PCOS is related. So PCOS interrupts the normal menstrual cycle and makes it harder to get pregnant. Between 70 and 80% of women with PCOS have fertility problems. This condition can also increase the risk of pregnancy complications. Women with PCOS are twice as likely as women without the condition to deliver their baby prematurely. They are also at greater risk for miscarriage, high blood pressure, and gestational diabetes. However, women with PCOS can get pregnant using fertility treatments that improve ovulation. Losing weight and lowering blood sugar levels can improve your chance of having a healthy pregnancy. Now let's see diet and lifestyle tips to treat PCOS. Treatment of PCOS usually start with lifestyle changes like weight loss, diet and exercise. Losing just 5 to 10% of your body weight can help regulate your menstrual cycle and improve PCOS symptoms. Weight loss can also improve cholesterol levels, lower insulin, reduce heart disease and diabetes risks. Any diet that helps you lose weight can help your condition. However, some diet may have advantages over there. Studies comparing diets for PCOS have found that low carbohydrate diets are effective for both weight loss and lowering insulin levels. A few studies have found that 30 minutes of moderate intensity exercise at least 3 days a week can help women with PCOS to lose weight. Losing weight with exercise also improves ovulation and insulin levels. Now looking up to how PCOS can be treated, the PCOS treatment focuses on managing the things that are concerning you. This could include infertility, hirsutism, acne or obesity. To regulate your periods, your doctor might recommend combination birth control pills. Pills that contain both estrogen and progestin decrease androgen production and regulate estrogen. Regulating your hormone can lower your risk of endometrial cancer and correct irregular bleeding, excess hair growth and acne. Progestin therapy. Taking progestin for 10 to 14 days every 1 to 2 months can regulate your period and protect against endometrial cancer. This progestin therapy doesn't improve androgen levels and won't prevent pregnancy. To help you ovulate so that you can become pregnant, your doctor might recommend clomiphene. The oral anti-estrogen medication is taken during the first part of your menstrual cycle. Letrozole, that is Femara. This breast cancer treatment can work to stimulate the ovaries. Metformin. This medicine for type 2 diabetes that you take by mouth improves insulin resistance and lowers insulin levels. If you don't become pregnant using clomiphene, your doctor might recommend adding metformin to help you ovulate. If you have prediabetes, metformin can slow the progression to type 2 diabetes and help with weight loss. Gonadotropins. These hormone medications are given by injection. To reduce excessive hair growth or improve acne, your doctor might recommend birth control pills. These pills decrease androgen production that can cause excessive hair growth and acne. Spironolactone, that is aldactone. This medication blocks the effect of androgen on the skin, including excessive hair growth and acne. Spironolactone can cause birth defects, so effective birth control is needed while taking this medication. This medication isn't recommended if you are pregnant or planning to become pregnant. Eflornithine, that is Venica. This cream can slow facial hair growth, hair removal. Electrolysis and laser hair removal are two options for removing hair. Electrolysis using a tiny needle inserted into each hair follicle. The needle sends out the pulse of electric current. The current damages and then destroys the follicle. Laser hair removal is a medical procedure that uses a concentrated beam of light to remove unwanted hair. You might need multiple treatments of electrolysis or laser hair removal. Shaving, plucking, or using cream that dissolve unwanted hair may be other options, but these are temporary and hair may thicken when it grows back. Acne treatments. Medication including pills and topical creams or gels may help improve acne. This was all for PCOS. If you still have any doubt, be free to ask in comment section. I will try to give the requested information. So if you like the information provided by us, make sure you like the video and subscribe my channel. Thank you. See you in the next video.